All right, here we go. How to tape a knee. For fat pad impingement, we're going to do a simple McConnell's taping, which is generally the type of tape we would use to help somebody who has knee or patellofemoral pain syndrome, which basically is a fancy name for pain because of your kneecap. So to do this, what we're going to do is, one, have the leg relaxed on a rolled up towel on the bed. So Geordie's nice and relaxed here, and we know because when I do this to a knee, I can actually move the kneecap. The second part is just putting some under wrap. So we've got some Fixable here. You can use this sort of stuff. We'll get it from the chemist, or you can grab them from here. For most people, they don't really need it, but if you're one that's allergic or you want it to stick a lot better, you can use this as your underlay. So first thing, measure underneath the kneecap firstly. So we're going to measure that, I'm going to cut that. And then we're going to do a few of those. So first one's going to go underneath, second one's going to go on top. And then the other one's going to come up like a little smiley face. Okay, so we're going to lay down the under wrap first. So peeling this. First one, if that's the kneecap, a little bit of a triangle. We're going to go to the bottom of the kneecap, like this. Okay, next one is on the top of the kneecap. Like so. And this one is for afterwards, okay? So here's what we're going to do. First one is, because what we're trying to do is gently draw the kneecap towards the midline, okay, is we're basically going to get a little bit of tape. We're going to place it on the outside of the kneecap. What we're going to do is gently push the knee across that way with my thumb, and then just lay it down like so. So what you're going to get is a little bit of this kind of creasing happening, which is exactly what we want. And I'm going to do that a second time. But this time I'm going to go half down. So same thing, but half down from the original taping. Push across gently, not aggressive, just gently, and lay it down again. So we got a little bit more creasing happening on the inside. Okay, and that's step one. So step one is gliding it this way so that your ITB isn't pulling on the kneecap this way, causing a bit of tension on that. The second one is to try and rotate the kneecap. So at the moment, even with Geordie, her kneecap, here's one part of the kneecap, the other part here, and then the tip here. So if I drew a triangle, it's actually pointing in this direction. I want to rotate that triangle this way. So the best way to do that is to get a bit of tape, start on the outside. I'm going to do a little bit of a smiley face. So I'm going to rotate under this and smiley face down. I'm going to do the same thing, but this time I'm going to go kind of half on the bottom like this. And I'm going to rotate upwards like that. Okay. Alrighty. And then the last one is literally just to give a little bit of room, because where your sore, if you have a fat pad impingement, is on the fat pad. If I tilt the patella this way by pushing down on the top, that'll give me a little bit of room for the fat pad to breathe a little and be less irritated. So the last one literally is going to be here, and I'm going to push down and up, just like so. Alrighty, so that's that. Then what I'll do is, with the white tape from previously, is just make sure that I hold all that down. Okay, so you can hold all that down like this, and you can do another layer if you want to just keep it neat and tidy. Like so. Okay. Now, As you get sweaty, sometimes this tape will come off, so you could do a bit of a wrap around if you wanted to, so bringing this whole thing all the way back through the back of the knee, but this should be enough for your type of taping. All right, obviously test it, make sure that you're happy with it, and that it feels good, doesn't feel restricted, that you can squat and it feels less painful, and that's how you know you've done a good job. All right, start with that and we'll see how you go.